there are lots of gaps in screening for people across the board, across race in the United States, because there's probably 5 different guidelines that doctors use for screening recommendations. So urologists really focus on the American Urological Association, the National Comprehensive Cancer Network guidelines, and some of us will also give credence to the European Association of Urology's EAU's guidelines as well. But primary care really focuses on the U.S. Preventative Services Task Force, which is like a decision-making body for the federal government for what kind of screening recommendations should be followed and paid for by insurances. And then there's the American Association for Family Practice. The problem is that these 5 different guidelines vary in the age at which you should start. Some of them are really explicit about what you should do for Blacks, but most of them are not explicit in the fact that you should do a different age or different frequency of screening. The NCCN guidelines does do that. That's the one that we really like a lot because it helps really spell out the PSA thresholds that people should use, when you should do a rectal exam, what age should an African-American or Black person start. And that's what's really nice about those. The Prostate Cancer Foundation has actually made specific Black prostate cancer screening guidelines, which I think is great. And it seems like they're on track with a lot of the things. They've used the literature that's out there to really make thoughtful decisions and even use modeling data, statistical modeling data, to really predict the right age to start, the right age to stop, which is also key, and the frequency with which you should do it, and adjust it for genetics and risk and other risk factors. So, big answer, 5 different guidelines, a lot of confusion, which means that patients have to actually sometimes advocate for themselves against the recommendation of their primary care provider, which they trust for every other, screening guideline, right? So most people don't argue with their provider about when to start a mammogram or when to get a colonoscopy, but there is wiggle room in prostate cancer, which is unfortunate for patients. And most patients don't even know what prostate cancer screening entails. Most of them don't know where the prostate is in their body, in fact. I do this thing in churches where I'll ask men to point out where the cervix is. If they were a female, where would the cervix be? Where would the ovaries be? Where would the uterus be? And sometimes even asking them the function, and they can guess those give me an answer really, really accurately. They tend to not know what the prostate is. So about 30 to 38% of men screen appropriately per year. And we would like to get that number up to 70 to 80%. So we have some work to cover.